Kia ora, ngā mihi nui kia koutou. My name's Chris Farrelly. I'm the Chief Executive of Manaia Health PHO, which is one of the two PHOs or primary health organisations based in Northland. Manaia Health PHO services the population of the lower part of Northland, the Kaipara district and the Whangarei districts. And we have an enrolled population of 93,000 people. We work very closely with our neighbouring PHO, Te Taitokoro PHO, and of course the Northland District Health Board. Social determinants and health must go and do go hand in hand. And in order to understand this, I think we look at 4 pillars or 4 PHOs which actually guide us in this direction. And the first is Te Tiriti o Waitangi, which is very dear to us, particularly here in Northland. And the treaty guaranteed equity, it guaranteed protection of treasures and taonga for Māori, and one of those taonga is health, and it guaranteed partnership. The second important document for us is the Human Rights or the Social Security Act of 1938, when all New Zealanders were guaranteed equal health care from cradle to grave. In fact, we're just celebrating the 75th anniversary of that remarkable piece of legislation, when arguably New Zealand was at its poorest. The third PHO would be the declaration which we call Alma Ata, the International Declaration on Health in 1978, which clearly identified health not just as being an absence of disease, but being about total social, physical, mental, psychological well-being. And in 2001, we had produced the New Zealand Primary Healthcare Strategy. And from that strategy, which is the 4th pillar, came PHOs. And that strategy basically focused on community involvement in health, that health was not just about professionals doing stuff to patients, but enabling the community to be empowered to actually care for their own health. It was about an integrated work team. It was about addressing the social inequities and social determinants of health. As you may know, 60% of all children born in Northland today are Māori. Māori population is our reality. Sadly though, 60% of all children born in Northland today are born into areas which we call decile 8, 9 and 10. They're majorly areas of poverty. In fact, 25% of Northland's children are living in poverty. As a health organisation, we must not just address health services, we must address what causes bad health or ill health in the first instance. And these are what we call social determinants. They're around poverty, unemployment and poor housing. Every child born in Northland should be born into a safe, caring, healthy environment, and the environment around them must keep them healthy and well. This is one of our tasks. Sadly, the environment does not always do this. Health has to come to the challenge. But this is not the job of the health sector alone. What is important is that the health sector partners with other sectors, partners with community, partners with education, with social welfare, with police, with whānau ora, and together move into the one waka and move forward. I like the analogy of a waka because a waka, as we know them in Northland, whether they be the waka ama or the more traditional wakas, are about a group of people moving in the one direction. And I think that's the secret for us in Northland. No one organisation, no one individual, no one sector can address the huge issues that we've got to face. It's a complex world, the health world, but it's very exciting because as we engage more and more in what causes bad health at the beginning and address those, we begin to see real and lasting change.